My name is Kavish Mehta, and today we are going to be going over the COVID-19 Mitigation Plan Report. We are going to begin with screening. When it comes to persons in care, we have to regularly monitor and document daily. We have to screen for temperature checks. We have to screen for symptoms of COVID-19. We also have to screen for a change in condition. Where there has been a case of COVID-19 in the last 14 days, we need to increase monitoring to at least twice per day. When there has been a resident that is in isolation or quarantine due to getting COVID-19, we have to increase monitoring to every 4 hours. Next, we will go into the current CDC guidelines. We need to conduct daily symptom screenings for COVID-19 symptoms. Some of these symptoms are fever or chills, cough, or shortness of breath, difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion, or runny nose. We must document any discovered symptoms in the resident's record. We will have to contact the resident physician and family. Temperature checks will be done at least once per day, up to twice per day if COVID-19 symptoms are detected. Any residents in isolation or that are quarantined, as directed by physician or local health department, will be monitored for worsening symptoms every 4 hours. Now the staff. We have to screen staff, check temperatures and symptoms prior to the start of each shift. We have to document these checks and the symptoms of our staff. Staff screening policies. We have to ensure employees with any respiratory infection symptoms are not at work. We have to screen employees for any respiratory infection symptoms or fever before they start working. We have to check employees for fever at least once per day. Keeping employees informed of facility COVID-19 preventions. Educating staff on how to prepare for and take precautions about COVID-19. Some of these precautions include not allowing employees with a fever to work. We cannot allow sick employees for at least 24 hours after the fever is gone. We have to reinforce the importance of performing frequent hand hygiene. We have to exclude anyone who is not critical to providing care from working. Next, let's talk about screening visitors. If the facility has a visitation plan, which we do, you must check for temperatures and symptoms upon entering the facility. We have to have COVID-19 signs posted. Masks and face coverings are required. There is supposed to be a designated visiting area, and hand hygiene and hand sanitizer must be available. If we continue visitation, screening policies must have a plan. This plan is as follows. We have to limit visitors by not allowing those with symptoms of respiratory infection or who have traveled in the past 14 days to areas having COVID-19 outbreaks. Essentially, if visitors have been in areas where there has been a COVID-19 outbreak, they are not going to be allowed. If they are showing any symptoms, respiratory infection, shortness of breath, or a fever, they will not be allowed. We have to limit entry only to individuals who need entry. The individuals who technically need entry are facility staff, contractors, volunteers, and consultants. These are essentially people who we need to keep the facility operating, to ensure that the needs of the residents are met. Government officials who require entry will be allowed. Allowing visits by immediate families or friends is acceptable, but no more than 5 people will gather. The reasons for entry are taken into consideration. Meaning, if there is a visitor that wants to visit a patient to drop off something, they can leave it at the front door. They can leave it with one of the caregivers. They don't necessarily need to enter into our facility or meet with the family or friends. We need to consider alternative methods of communication. We need to explain these to visitors. This will be discussed later. We have to deny entry to anybody with a temperature above 104. Most importantly, we need to provide hand and respiratory hygiene and enforce cough etiquette by residents, visitors, and employees. Hand and respiratory hygiene. Hand hygiene is essentially washing your hands or using hand sanitizer. Respiratory hygiene is always wearing a mask, covering the nose and the mouth. Enforcing cough etiquette by residents, visitors, and employees is simply coughing into your arm. Next, let's discuss the signage and postings. We need to explain facility implemented precautions for entering and exiting. We need to deny visitors with any symptoms of respiratory illness. We need to deny entry to anybody who may have recently traveled within the past 2 weeks to an area that has had a COVID-19 outbreak. We need to strongly encourage members and friends not to visit. Discuss alternative methods of communication. Alternative methods of communication may be FaceTime, text message, or simply a phone call. We have to establish specific visiting hours and limiting visitors to daytime hours when staff can more closely monitor a visitor's entrance. Some of the postings we may include in your facility are you feeling ill? Let's keep our facility clean. No visitors allowed. This entry is closed. Wash your hands. Don't touch your face and avoid sick people. The facility will require all visitors allowed entry to wash their hands for at least 20 seconds at a facility hand washing station. We have set up hand washing stations, or more importantly, hand sanitizer stations inside the main entryway with signage reminding people to wash before entering using the supplies provided. We have to insist visitors use hand washing or hand sanitizing. This has to be done after going to the bathroom. They have to use hand sanitizer before eating or wash their hands before eating. They have to use hand washing or hand sanitizer before and after providing care to residents, after blowing your nose, coughing, or sneezing, and most importantly, if the hands are visibly dirty. We have to clean and disinfect frequently touched objects visitors may use. Some of those would be toilets, faucets, bed rails. We have to disinfect telephones and door handles. We have to disinfect kitchen food preparation surfaces. And most importantly, we have to disinfect the rooms after each meeting between a visitor and person in care. So essentially what this means is that when a visitor comes in, we need to not only screen them for temperature, ask them if they've had any symptoms, shortness of breath, fever, if they've been anywhere that has had a COVID-19 outbreak in the last 2 weeks. If they have met all of those requirements, they need to be 6 feet apart when they meet the patient. When they meet the patient, we need to keep a good eye on the things that they're touching. If they went to the bathroom, if they touched the bed rails, did they touch the telephone or any door handles? Likely they did. We need to disinfect and clean these areas after they leave. Most importantly, we need to disinfect the rooms that they went into. This is basically explaining the alternatives for families and visitors to communicate with residents. As I said, FaceTime, telephone, or texting. are options for communicating with residents. They don't necessarily have to have a face-to-face visit and go into the facility. We need to ensure emergency contact information is up to date. We have to limit visitors to medically necessary visits. We are not allowed to restrict visits from CDSS, local health officials, healthcare providers, ombudsmen, anybody who is essential government authority. However, we reserve the right to conduct screenings on all individuals before entering. We require visitors, residents, and staff to wear facial coverings. No exceptions. We will permit visits from medically necessary staff. This will include hospice, home health. The facility will require visits must be scheduled in advance. Facility will require that visits must be subject to staff availability. And there is a limitation to the number of visitors to enter at any one time. Indoor visits may only be allowed if there have been no new transmissions of COVID-19 at our facility for the past 14 days. If there has been a new transmission, indoor visits are not allowed. The facility is not experiencing staff shortages and can adequately screen visitors. If we cannot adequately screen visitors, indoor visits are not allowed. We have to be able to interview possible visitors regarding COVID-19 symptoms. If we are unable to do this, and ask them, have you had shortness of breath? Have you had a fever? Have you visited anywhere that has had COVID-19 in the past 2 weeks? Indoor visits are not allowed. If visitors show no signs or symptoms of fever or respiratory symptoms, indoor visits may be allowed. If visitors wear appropriate PPE, indoor visits may be allowed. Visitors have to wear PPE during the entire visit. Facility has a dedicated visitation area. There must be 6 feet apart between residents and visitors. We have to clean and disinfect the visitation areas after each use. Our facility must have a designated an area near an entrance and exit if it helps ensure other residents are not exposed to visitors. The facility has an area where an increase in ventilation or fresh air circulation is possible. Facility reserves the right to insist visitors be tested and get a result before visiting. Essentially, we are allowed indoor visits if there have been no new transmissions, if the facility can adequately screen visitors, if we can interview and screen them regarding COVID-19 symptoms, and if they show no signs. They must always wear PPE and stay 6 feet apart. We have to disinfect the area that they visit, and if possible, we need to open up a window in the area that they are visiting or the room of the patient to allow for increased ventilation or fresh air circulation. We must insist visitors be tested before visiting our facility. This will conclude Section 1 of COVID-19.